Thank you to my friends, Dr. Sally Fool, Laura Matello-Rooney, Jeannie Paredes, and Kathleen Powderly. I appreciate you and the SUNY Downstate Health Sciences team for continuing this important conference. I look forward to this annual symposium, and as the grandson of Henrietta Lacks, I'm honored to leave you with these closing remarks. My grandmother was a loving wife and a mother that passed away from metastatic cervical cancer. Like so many, the cancer that ravaged her body left her 5 children, husband, her family, and the community mourning her passing, all too soon at the early age of 31. Yet, what was also phenomenal about our Henny was the HeLa cells that were taken unknowingly that will go on to impact the entire world. The woman in my family would always say she was an original Black girl magic. This year, in honor of her 100th birthday, our family launched the HELA100 and Henrietta Lacks Centennial CELLebration. That celebration with CELL. We invited the world to support our mission to preserve Henrietta Lacks' legacy by educating future generations on the impact of her phenomenal HeLa cells while promoting health equity and social justice. It's been an incredible year, and we are grateful for the outpouring of support from our leaders and advocates worldwide, including the World Health Organization, National Women's Hall of Fame, the leadership of the Divine Nine, Miss America, ACS CAN, and many more. You can learn about our efforts and how to collaborate with us at HELA100.org. Recently, we were proud to see the passage of the Henrietta Lacks Enhancing Cancer Research Act was signed into law at the end of 2020. This act honors my grandmother's name, and I was proud to begin this initial journey with our dear friend, the late Congressman Elijah Cummings. My family is also grateful to Senator Van Hollen, Congressman Nfume, and the patient advocates at ACS CAN who helped to make this law possible. The act calls for the Government Accountability Office, GAO, to complete a study that reviews actions taken by federal agencies to help to address barriers to participation in federally funded cancer research trials by populations that have been traditionally underrepresented in such trials. This would include a review of cancer clinical trials that are largely funded by federal agencies, including the NIH. Clearly, this is a long overdue step towards meaningful public policy change. As many of us here today know all too well, despite the fact that communities of color and other marginalized groups experience higher cancer rates and barriers to high quality care, we continue to face challenges when enrolling and participating in clinical trials. This act will help ensure all groups have more equitable access to potentially life-saving advances in cancer research and is a worthy reflection of the impact of my grandmother's life. My family is proud that this impactful public policy change will continue the lasting medical and scientific improvements for all people in the name of Henrietta Lacks, the mother of modern medicine. Today, we've heard about the cancer disparities that persist, but also from incredible leaders and advocates that are closing these gaps. As we end today, I'd like to leave you with this. Just like my phenomenal grandmother Henrietta Lacks' resilient HeLa cells, we are greater than COVID-19, social injustice, and yes, even cancer. As we enter the next phase of scientific advancements in AI and beyond, let us remember my grandmother, her story, and my family's journey. That we honor her by putting all patients at the center of what we do and how we do it to truly advance health equity. On behalf of my family and my grandmother, Henrietta Lacks, we would just like to say thank you and God bless.